Hello, this is Dr. Amin Marashi, retinal specialist in Marashi Eye Clinic in Aleppo, Syria. I am presenting the course of Structural Enface OCT. This presentation will present the Structural Enface OCT findings in pseudophakic cystoid macular edema, hereditary retinal diseases, and choroidal rupture. In cases of pseudophakic cystoid macular edema, it is essential to check the ILM lab to rule out vitreomacular abnormalities. However, in long-standing cystoid macular edema post-pseudophakia, the ILM may show some premacular tractions. The IPL-INL slab will show hyperreflective cystic changes with spongy appearance. Please note the blink artifact. The OPL-ONL slab will show hyperreflective cystic changes in flower petal configuration following the Henle fiber layers pathway. The subretinal fluids may show an inner hyperreflective circle with hyporeflective content depending on the subretinal fluid's size and thickness of photoreceptor layer. Please note the blink artifact. The RPE slab will show projection artifacts in severe cases. Enface OCT can help to have a pan view on the cystic changes distribution in the posterior pole and help to follow up the cyst's resolution post-treatment. As shown here, those are the same slabs for the same patient post-treatment with a suprachoroidal injection of triamcinolone showing resolution of the hyporeflective cysts. In cases of retinitis pigmentosa, the ISOS junction slab will show decreased reflectivity in photoreceptor loss areas. In cases associated with macular involvement, the choroidal slab may exhibit some hyporeflective lesions corresponding to the intraretinal pigmentation. The IPL-INL slab will show hyporeflective cystic changes in cases associated with cystoid macular edema. The RPE slab may show projection artifact from the overlying edema and peripheral pigmentary changes. Please note the blink artifact. Enface provides a pan view of cystic changes and their location in the posterior pole, helping follow up post-treatment. As shown here, in this case showing IPL-INL slab pre-treatment showing hyporeflective cystic changes and post-treatment with oral acetazolamide showing resolution of the hyporeflective cysts. In cases of Stargardt disease, the ISOS lab will show disruption of photoreceptor layer in the form of decreased reflectivity. Some cases may present some increased reflective lesions, maybe due to flex. The RPE slab may only show some decreased reflectivity. However, the choroidal slab may show transmission defect in the form of increased reflective patch. In cases of X-linked juvenile retinoschisis, the GCL slab may show hyperreflective holes, identifying the level of schisis in this layer. The IPL-INL slab will show a central large hyperreflective cavity with symmetrical radial cystic formation in spoke or polygonal-like configuration, especially at the OPL layer, within a thin irregular wall. However, there would be a central hyporeflective cyst in later stages due to coalescence of the intraretinal columnar cystic formation. RPE slab may show some projection artifact in advanced cases. Enface OCT can help to differentiate between cystoid macular edema, myopic schisis, and juvenile retinoschisis. In cases of Best disease, the RPE slab will show increased reflectivity at the areas of vitelliform lesion accumulation, where subretinal fluids may appear hyporeflective. For example, in vitelliform stage, the RPE slab will show a central granular hyperreflective lesion. The pseudo-hypopyon stage will appear as hyporeflective in subretinal fluid areas with hyperreflective margins in areas of vitelliform lesion accumulations, all located inside a hyperreflective thick disc. Please note the blink artifact. In vitelliform stage, the RPE slab will show hyperreflective lesions, vitelliform lesions surrounded by hyporeflective areas subretinal fluids. Please note the blink and motion artifacts. However, in the atrophic stage, the choroidal slab will show transmission defects in the form of hyperreflective patch. Please note the blink artifact. In fibrotic pilar cases, the RPE slab will show a central hyperreflective lesion inside a hyporeflective pocket associated with segmentation artifact in choroidal and IPL inal slabs. Please note the motion artifact. In cases of adult vitelliform dystrophy, the RPE slab will appear as a small area of increased reflective small hyperreflective circle of photoreceptor layer. However, the hyperreflective contour can be due to photoreceptor layers interface. The vitelliform material with more contains a heterogeneous granular hyperreflective material that may decrease in reflectivity and become more homogeneous in deeper slab. However, the RPE elevation can show hyperreflective bumps. In contrast, the hyperreflective crescents may simulate associated subretinal fluids. In cases of choroidal rupture, the RPE slab will show choroidal rupture in slightly hyperreflective borders corresponding to the area of RPE protrusion. The choroidal slab, it will show the choroidal rupture as an area of increased reflectivity in crescentic shape parallel to the optic nerve or ora serrata. Thank you for listening. I hope you found this course beneficial in your daily clinical practice. Please visit my website www.amretina.com to see more online courses and clinical guidelines.